back to the Tooth Doctor YouTube channel. I'm Trevor, and this is the one and only Dr. Peter Yoo, the Tooth Doctor. And today we're going to be talking about a topic that is close to your heart: dental implants.
Okay.
I know.
Close to your mouth, I guess. Yeah.
Exactly. So Lord Byron said, "Always laugh when you can. It's a cheap medicine." Perfect. Well, just so you know, there are 3 million people in the U.S. who have dental implants, and that number is growing by 500,000 each year. Oh. Job security, my friend. Job security.
I guess so. You know, it's the coming of age, and you know, there are many things where people don't want to have dentures or missing teeth, and people are more concerned about their overall health, right? Why are there so many more dieting fads out there? You know, there's so many things that people want to do to make themselves better. Yeah,
100%. So we're gonna simplify this for everyone, and I'm gonna ask you a basic question: what is a dental implant?
Simply put, it's a screw. It replaces what the root would look like, and then you put a cap on top of that screw, and it's all nicely placed together, and it replaces what your tooth was like before. Yeah.
Awesome. So rather than just having a gap there, you can put something that looks exactly like a tooth. That's awesome. So now, why do you recommend an implant for missing teeth as opposed to another solution?
That's a long story, but I'm going to share that.
Okay.
Back in the day, there was dentures. Everybody knows about dentures. You take them in, take them out. You know, you see grandma has it in a little cup. You know, it worked. But again, the inconvenience, you know, people went from wearing glasses to wearing contacts, and now people are getting laser eye surgery. Right. There are things that are just progressively, it's becoming more, we were trying to become more natural as possible.
Okay.
Right? So, you know, why do I recommend it? It's, you know, a colleague told me it's the Cadillac of dentistry. You know, you want to place, you know, I don't want to just take a tooth out and put an implant in there, but there are reasons why people end up losing a tooth. And when you do, you know, placing an implant is the most similar replication of what a tooth would be like. And you're not damaging teeth, you're preserving the bone, you're able to keep it clean, you don't have to take something in and out of your mouth, you don't even know it's there. And so there's, it just, and the prognosis, the longevity of implants are great.
Okay. So what are the possible problems that people could experience if they don't replace missing teeth?
I see many people with missing teeth. Yeah. So is it a big problem? Not really. But there are problems. When you're missing a tooth, your body's in balance, okay? You know, I know people, they have missing fingers and they still go about the day. But how many of you people wouldn't mind missing a finger or wouldn't care to miss a finger? It's kind of, you know, one of those things that you have to say as a person, you want to be as whole as possible. And so with your teeth, when you're missing a tooth, you lose balance, teeth can start shifting, which can lead to cavities, can lead to bite pain. I get a lot of patients coming in, they have a toothache, and a big reason why is because the bite is heavy. Okay. And that can lead to some quite excruciating pain at times. We also, by losing a tooth, you lose the bone around that area. Well, that bone is also protecting, is holding the teeth beside it. So when you start losing bone, then the gums pull away, people get sensitivity, recession.
So bad news all around. So how many appointments does it take to replace a tooth with an implant?
Usually I would say, you know, I'm thinking probably around 5. You know, there's the consult, discuss what's going on. Then there's the actual surgery day where we place the implant and get everything all, I guess you say, placing the screw.
Okay.
Then usually we have, you know, 1 or 2 appointments afterwards just to make sure everything is going well. You know, patients are keeping things clean, they're brushing, you know, the stitches are doing okay. Then it comes the impression, where they come in and we're basically make a copy of their mouth, where the lab can make a tooth, and then the actual insertion day, where we place the implant, place the crown on the implant, and they got a brand new tooth.
Wow, that's amazing. The things that you can do nowadays with modern dentistry. So, are they really noticeable, or do they look just like normal teeth?
It makes me laugh because it reminds me, actually, one of my patients. We put a silver tooth on the implant. So the person wanted something different, but to each person their own. We want the crowns, the teeth to look as natural as possible. And many times you look at it and go, oh, that's not your real tooth. There are many people that ask those questions. So yes, we want to make them look as natural as possible.
Now, do implants ever need to be replaced or redone?
With anything, nothing is ever 100%. Okay. I seen that commercial with the Toyota Corolla that went 800,000 kilometers. I'm sure the guy had to take it to the shop to get some parts changed. Do a few oil changes and things like that. So they say the success rate in an implant is about 96 to 98%. Okay.
Wow.
Every once in a while you have to go in, and the key thing is maintenance. Okay. Coming in, getting your teeth checked. Dental implants are different from natural teeth, and that's something that people have to keep in mind. They can't just get an implant and disappear on the dentist for like 5, 6, 7 years. Okay. That's not going to happen. That's not going to work. There's going to be failures if the bite is too strong. The screw can loosen, various things like that. So I've had patients where they've chipped a little bit of porcelain off the tooth, and the great thing is with the implant, you can just unscrew it, send it to the lab, they add the porcelain back on, place it back in, screw it back on, and it's back to normal again. You don't have to basically do brand new bridge or implant or denture.
Wow, that's amazing. That's really good news.
Yeah.
So, just briefly before we started talking today, you were talking about some new technology that you learned about recently. Maybe you can share a little bit about that and how that has changed how implants are done and how that improves the performance.
Well, I went on a course and just about how to place implants and when to place implants. So normally you need to have the bone healthy and healed, and when you place the implant screw, it requires about 3 months for the bone to kind of join with the tooth, and that's something called osseointegration.
Okay.
So the bone kind of, the thread of the tooth and the bone will go in and it'll kind of bind with the implant to make it nice and solid. So you'd have to, if we pull the tooth out, we'd actually have to wait about 3-4 months to let the bone heal, then place the implant, wait another 3-4 months for it to heal, and then we can go in and place the tooth on top. So recently there are more studies coming out about placing, we call it immediate implants. You break a tooth, you take the tooth out, and then right away you place the implant screw and replacing the root. And now you've kind of shortened your healing time and just overall replacement of that tooth by 3 months, by almost half. So
that's remarkable. So there's so many things that Dr. Yoo can help you with. Implants is just one of many things that he can do and he's able to help you with. And if you like what you've heard here, please give us a thumbs up and tell us how we're doing down in the comments below. And don't forget to subscribe to the channel, and we will catch you guys next time. We're always going to have new things in store to talk about all things dentistry from the Tooth Doctor.